Hello everyone, we're just past 1 p.m. so we're going to get started. Thank you for joining today's webinar, Mental Health Impacts, Inequities and Investments for BC's Recovery. I would like to begin by acknowledging that today's webinar is broadcast on the unceded, traditional and ancestral territory of the Musqueam, Squamish and Tsleil-Waututh Nations. I would also like to quickly credit our previous webinar presenters, Jenny Morgan and Vanessa Bursick, for the slides you see in front of you. My name is Amelia Hamfelt. I am a policy analyst at the Canadian Mental Health Association BC Division, and I'll be your host for the next 50 minutes or so. To start us off, I would like to point out a few features of the technology we're using and quickly run through the agenda. First of all, there are two options for sound. You can listen with your computer's audio or dial in by telephone. If you find that you're having difficulties with one audio option, please consider switching to the other at any point. A hot tip, if you choose the telephone option, a landline is preferable to a cell phone and will result in clearer sound. Second, we'll be recording today's session and posting the video online at getloudbc.ca and distributing it by email the following week. Third, after our CEO's opening remarks and the panel discussion, there will be an opportunity for audience members to ask questions. Please type your questions into the questions section of your panel to the right. I'll collect them throughout the webinar and read them out to panelists during the Q&A period in the order I receive them. If you'd like to address your question to a specific panelist, please make a note of this in your submission. We'll try to get to as many of your questions as possible before the end of the webinar. Okay, I'll now turn it over to our CEO, Johnny Morris, for his opening remarks.
Well, thank you very much indeed, Amelia, for again convening such an important dialogue, both with our esteemed panelists here and also the attendees who are joining us right now. I do want to echo what Amelia said. Today I am zooming in from unceded and ancestral territories of the Tsleil-Waututh, Musqueam and Squamish peoples, and just given the work we're going to do together and the ground we're going to cover, absolutely important and critical that we hold those acknowledgements close, no matter which territory folks are dialing in from. Today, I think kind of remarks upon a body of work that our association across our network in BC and partners have been doing for some time in light of the ongoing pandemic, both the pandemic response, the intended and unintended consequences of that, and then of course the collective experience of the impacts of responding to COVID-19. I think all of us are starting to recognize or have recognized for some time that the collective experience we're having has had very, very much significant impacts upon our mental health and well-being collectively at a population level. And I think many of us are very concerned as well as to how COVID-19 and the response and the impacts of COVID-19 have revealed fault lines of inequity and disproportionate impact, not only in the experience of responding to COVID-19 and COVID-19 itself, but also the impacts in light of mental health, mental ill health, substance use as well. And so today's webinar really, I think, serves to continue to shine that light upon those disproportionate impacts and underscores the associations and I think our partners' concerns about the moral imperative, the critical need to ensure that mental health and well-being is of paramount concern and integrated into the ongoing development of a pathway to recovery here in the province. We have to acknowledge the significant loss of life due to deaths related to fentanyl recently. We have to acknowledge the worries and concerns not only around the existing loss of life due to suicide, but also the risks that sit with us around increases there. And for folks living with disability, racialized folks, folks who live with a mental health or a substance use problem, folks who experience isolation, the impact of COVID has been significant, and the data that you're going to hear Dr. McAuliffe speak to underscores that in lots of detail. We've assembled a panel under Amelia's stewardship that provides a multi-perspectival take on both where we've come from and our current state. And each of the panelists, Dr. McAuliffe, Dr. Wyman, and Julia Keisler, provide the thought leadership, some thought leadership that's absolutely needed here as we chart a path forward. And I think will help all of us start to gather around the recommendations, the policy asks, the need for investments, the systems that need to continue to evolve and change to help us build out not only the comprehensive continuums of care that we need to ensure mental health for all as we move forward, but also the opportunity. Mental health probably has not been talked to as boldly as before, given what we've been experiencing through COVID-19. I'm so pleased to welcome all of you today. Thank you for spending time with us on incredibly important topics, both for dialogue and action. Thank you to Amelia for convening us, and a heartfelt thank you to each of the panelists today for sharing your expertise, your vision, your strategic thinking, your knowledges, and helping us collectively chart that path forward. Back to you, Amelia.
Thanks so much, Johnny. Now, before I introduce our panelist, I would like to add a little bit more context for today's discussion. Just last month, many of you know, the province launched a public consultation to ask British Columbians how our healthcare system can be strengthened and what their top priority is for BC's restart plan. CMHA encouraged our community to participate and asked that they share their stories of mental health and substance use during the pandemic. Our goal was to ensure mental wellness was a clear priority for the province's pandemic recovery and planning for a possible second wave. We're incredibly grateful to everyone who sent letters. We heard so many diverse and unique stories with a number of important commonalities that touched on a number of the issues that Johnny just spoke about. We heard that people living with mental illness or substance use are experiencing a worsening of symptoms since the onset of the pandemic, and service closures have limited their ability to seek help. Some continue to see their mental health practitioners through virtual means, but many others have lost touch entirely or have yet to find adequate care. We heard that people all over the province are losing loved ones to overdose. There is an urgent, critical need for safe supply and more accessible substance use treatment. We heard that people across the province are facing social isolation, uncertainty about the future, loss of employment, and financial strain that's having a negative impact on their mental health and use of substances. There's particular concern for the well-being of children and the long-term impacts of the pandemic and public health emergencies on their development and functioning. Lastly, we heard loud and clear that there's a pressing need for more accessible mental health services under MSP and more comprehensive social supports that build on the investments already made at every level of government. We convened this webinar today to begin to unpack some of these issues, learn from the latest research on the impacts of the pandemic, and identify systems-level strategies for better mental health for all. I'm very pleased to introduce our panelists who will lead our discussion. There has been a small change to our lineup. Dr. Emily Jenkins has stepped away and asked her colleague and co-investigator, Dr. Corey McAuliffe, to join us on her behalf. Dr. Corey McAuliffe is a postdoctoral fellow in the School of Nursing at the University of British Columbia. Her research focuses on structural and systemic barriers that prevent youth and learners from reaching their full potential. She aims to impact policy and influence social change and equity through heightened attention to contextual and cultural differences. Her current research examines the impacts of the COVID-19 pandemic on the mental health of people living in Canada. Her past research explored mental health and well-being of graduate post-secondary students, the harm of work precarity to students, and the experience of sexual and gender-based violence and misconduct in university and workplace settings. Dr. McAuliffe received her PhD from the University of Toronto, as well as a Master's of Public Health from Emory University. She has over 15 years of experience in global and public health practice, teaching and training within academic, governmental, and non-governmental organizations. Welcome, Corey. Next is Dr. Nell Wyman, who is the acting Deputy Chief Medical Officer at the First Nations Health Authority, and an adjunct professor in the Faculty of Health Sciences at Simon Fraser University. Nell is Anishinaabe, Little Grand Rapids First Nations from Manitoba, and Canada's first female Indigenous psychiatrist. She completed her medical degree in psychiatry specialty training at McMaster University in Hamilton, Ontario. Since then, her career has spanned clinical, academic, and public service sectors, from providing psychiatric services at a community mental health clinic to contributing to the development of a national framework addressing First Nations youth suicide. Her many roles have included co-director of the Indigenous Health Research Development Program, assistant professor in the Faculty of Medicine at the University of Toronto, faculty advisor to the Indigenous Students Health Sciences Office at McMaster University, co-investigator for several initiatives funded through the Canadian Institute of Health Research, staff psychiatrist at the Centre for Addictions and Mental Health, board member of Indigenous Foundation, and president of the Indigenous Physicians Association in Canada. Nell's clinical, academic, and advocacy work has always been focused on improving the health and mental health status of Indigenous peoples, especially Indigenous youth across Canada. Welcome, Nell. Julia Keisler is the Executive Director of the CMHA Northwest Vancouver branch. She oversees diverse programming for North Shore residents that includes low-cost counseling, peer support and navigation, mental health housing, homeless outreach services, and employment support and training. Despite the intense demands of her job, Julia feels privileged to serve communities that care so deeply about the mental well-being of the people that live there. Prior to her work at CMHA, Julia honed her skills in communications and community relations, working for Pacific Blue Cross, and completed an MA in conflict analysis. Okay, now that we're all in the same virtual room together, I'll ask that the panelists turn on their webcams, and we'll start the panel discussion. Corey, can you start us off by sharing some of the key findings from your research on the mental health impacts of the COVID-19 pandemic?
Yeah, thank you so much. And so sorry to everyone that I'm unable to share my webcam with you. But thankfully I have some slides here that I can share that Amelia will help me with. So I just wanted to thank you all for giving me this opportunity to share. And I want to start first and foremost by identifying that within the context of COVID-19, the mental health of our populations has been greatly impacted. So as we see on the next slide, the mental health consequences of COVID-19, if you can move to the next slide, have been characterized as the fourth wave of the pandemic and are projected to be responsible for the largest and most enduring health footprint. So next slide, please. Knowing how profoundly the everyday conditions in which we live, also known as the social determinants of health, impact our health and well-being, our study aimed to better understand whose mental health is most impacted, how the pandemic is contributing to widening mental health inequities, and what coping strategies or resources are being used to sustain mental health. So this is with the overall intention to inform equity-oriented policy and health systems responses that are grounded in strong and reliable data that is representative of those living in Canada. You can go to the next slide. From May 14th until May 29th, 2020, Maru Matchbox dispatched our online survey among a randomly selected sample of adults living in Canada, and this was for a total of 3,000 participants. And we looked at 7 major constructs of interest, and because our aim is to identify who is being impacted, I'm going to now discuss a few of these constructs while illustrating different axes of vulnerability. So on the next slide, in terms of self-reported change to mental health, 38% of the respondents indicated a deterioration in mental health. And the most frequent deteriorations in mental health were among people with pre-existing mental health conditions at 59%, those with a disability at 47%, young people ages 25 to 34 years of age at 46%, people with children under 18 years of age at 45%, women at 44%, and those with an annual household income under 25,000 at 43%. So also important to note that some of the people reflected here would belong to more than one category. And this is the next stage of our analysis, where we are exploring an intersectional perspective to see how experiencing multiple vulnerabilities further shapes the risk. So on the next slide, we can see that the most commonly endorsed emotional responses to COVID included anxiety or worry, boredom, stress, loneliness, sadness, and depression. There were also signs of resilience, with some respondents feeling calm, hopeful, empathetic, and content. But at this time, challenging emotions predominate, especially for those with a pre-existing mental health condition, those with low household income, for young people, parents, those with a disability, and all of these people noted higher levels of negative emotions. So on the next slide, we recognize that beyond concerns about the virus itself, fears related to finances and job loss were among the greatest sources of stress. And those with lowest income and who were younger had the greatest financial concerns. In the next slide, while substance use is noted as a coping strategy, within the overall sample, 19% of respondents indicated that their use of alcohol had increased as a result of the pandemic. This is concerning given that restaurants, bars, and pubs had been closed during this time period, meaning that much of this increased use was likely taking place in isolation and alone. And in terms of cannabis use and prescription medication use, those with pre-existing mental health conditions endorsed about double the use than the general population. And on the next slide, in the overall sample, 6% endorsed suicidal thoughts or feelings, and 2% identified deliberately harming themselves. Again, those with a pre-existing mental health condition were more likely to report these experiences at 18% and 4% respectively, followed by Indigenous people at 16% and 4%, and people with a disability at 15% and 3%. And people with household income under $25,000 were more likely to report suicidal thoughts and feelings at 14%, but did not identify greater likelihood to self-harm. And then on the next slide, not surprisingly, things at home have also deteriorated, with 12% of parents being worried about being safe from physical or domestic violence. 29% were consuming more alcohol in order to cope, and 45% were concerned about finances, and over 1 in 5 reported concern about food security. So this concludes my brief introduction to our findings, and I'm looking forward to continue to share more with you all.
Thanks, Corey. I really appreciate that overview. The next question I'm going to turn to Nell, because you highlighted some disproportionate impacts on Indigenous communities. Nell, what are some of the factors that have led to Indigenous peoples experiencing more severe mental health and substance use impacts during the pandemic?
Great, thank you for the question, Amelia. You know, the answer I think is really quite complex, and so I'll just try to lay down a few thoughts. Of course, initially when the pandemic was developing, you know, out of my work at First Nations Health Authority, we know historically that, you know, First Nations and Indigenous people across the country have a poor history or poor experience with pandemics, going all the way back, you know, to ones that took place 100 or more years ago, around the time of contact colonization, and then of course even more recent pandemics like the 2009 H1N1 pandemic, where there was a very poor response, and in some cases a very devastating response for communities. The reporting around the communities in Manitoba that were sent body bags by the federal government as a response to the pandemic, as opposed to sending aid of any type. So, you know, there's that historical overlay. So when COVID happened, you know, I think immediately people were put into a state of apprehension, anxiety, as Emily mentioned, that, you know, there's so much uncertainty about what's going to happen. There's a total loss of control as we went into lockdown, and now as we have sort of sequentially started to open up, we still, you know, don't have that sense. I don't think all of us that we have much control over what's happening. And so because of First Nations experience also with trauma, so historical trauma, intergenerational trauma, and indeed contemporary trauma that's going on in our communities, the pandemic is just sort of one thing more that's piled on top. And people, of course, have a reaction to that. I think the other thing to note that's different, perhaps, for our communities is, because a lot of our population lives in rural and remote communities across the province, there was a great deal of worry about protecting our elders, especially. So people who are our knowledge keepers, the holders of our language and our cultural practices and ceremonies. And they're a very precious resource. And I think initially, as we started to learn a little bit about the coronavirus and know who was at particular risk, the people who were identified were those that had serious pre-existing medical conditions, the elderly, and those with compromised immune positions. And I would argue that our BC First Nations elders should also be considered a population that we need to be especially protective of because of that value of culture that they bring, not just to our own First Nations, but indeed to the entire province and the country. So that's one. I think that's a different factor. And then I think the other thing that I can identify that that happened was, because of the necessary public health measures, including things like maintaining a physical distance. And initially it was called socially distance. And so I think people, in our communities tend to be, first of all, there's multi-generations of families oftentimes living in housing because of poor social determinants of health. But there is also a close-knit community that, there are close-knit communities. And so this messaging that we needed to stay apart, that we needed to stay at home, created, I think, some feelings around social isolation. And so we've done quite a bit of messaging at First Nations Health Authority around we might need to be physically distant right now, but that doesn't mean we can't be socially connected. And the last thing that I'll end this section off with is, yes, I think that we have been disproportionately affected by the pandemic on a number of indicators, but also that this has been a time for us to tap into our own Indigenous resilience and strengths. And that's another thing that we have tried to message about, is that, we've been through this before and we have survived, and we will get through this again.
Thanks, Nell. I really appreciate you ending on that note of strength. Julia, I'll turn the next question over to you. Within your community on the North Shore, how has the pandemic led to increased hardship for people living with mental illness and substance use?
Yeah, thank you. And I think Nell has definitely highlighted a lot of the challenges that people across the community are facing. And what I would say here on the North Shore, I mean, we're a relatively small, relatively affluent community. Here at CMHA, we provide residential mental health care for people with mental illness and substance use disorders. And, like all of us, I think that they felt quite lonely and isolated through this pandemic. There was often times when we had to limit outside visitors, much like you see in some of the seniors facilities. And it's a precarious relationship often that people have with family members, that they're trying to rebuild these connections. So I think that it really felt like they were very cut off from their community. And we've been able to, obviously, as a society, we have all sorts of systems in place to maintain, like, people getting their psychiatric medication and various other things. But what does mental health care really mean? It means really, providing psychosocial rehab and community connection. And I think that was really negatively impacted. So I'm not surprised to see people's mental health deteriorating, especially people with previous mental health diagnoses. I think one of the things that has taken up most of my time here on the North Shore is really, despite being an affluent community, and I think many other communities around the province can relate, we have a massive housing problem here in our community. And, you know, it's going to take a lot of courageous leadership to really change that. But we have people living very precariously. And I would argue in my interactions, and this is likely anecdotal at this point, that many of those individuals are facing other barriers. Like they often are racialized, they have physical disabilities, they struggle with pain, they are Indigenous, you know, we're not doing a great job of providing support for them. So I would say that during this pandemic, that their housing situations got much more dangerous. And I would say that because of the pandemic, I think the risk, the fear that they're experiencing, plus the moratorium on evictions meant that there was a lot more surplus money for people in the houses. So, you know, we were dealing with a lot of clients who were in very difficult situations and having friends dying by overdose. So, you know, it's been a really tough go for a lot of people. And then the last thing I'll say is just really around like employment and what a huge impact this pandemic has had for people's financial well-being. And we provide a lot of services for our immigrant community, newcomer community here on the North Shore. And our counselors who work on those sites, they pretty much describe this as a dual pandemic, that it feels like a very different experience for those who are in more affluent communities with a house and space that they can talk openly in and you know, go outside, versus a lot of the communities where there are many people living in a house and they just don't have the space that they need. I think there was definitely a feeling of hopelessness and an increased sense of fear in those communities in particular. So employment and the insecurity around employment has worsened people's mental health care in a significant way.
Thanks, Julia. I really appreciate all of your comments that have really demonstrated the health and social inequities that have been perpetuated by the pandemic. We also know that there's many recent events within Canada and the United States that have similarly laid bare structural racism and discrimination towards Indigenous peoples and all people of color. Both have profound implications for mental wellness. Now, I'm going to turn it back over to you as we move into looking at kind of ways forward and solutions. How can the province partner with Indigenous peoples to begin to address some of these longstanding issues and improve mental health outcomes during and after the pandemic?
Thanks, Amelia, for that question. Again, it's another one that probably would merit its own webinar, but I'll try to hit, I think, some of the important points. You know, the whole pandemic has really been a challenge, and we feel at First Nations Health Authority that we're really dealing with three major kind of emergencies. Of course, the two declared public health emergencies of the pandemic and the opioid crisis, as Julia has identified, and also racism. So most people, I'm sure, are aware that there has been an inquiry started headed by Mary Ellen Chappelle looking at racism in BC's healthcare system. And so I think one of the first things you know, that we have to do is actually to, I think at all levels, acknowledge that this actually exists. Because there are still a lot of people who will say, you know, after the inquiry was announced, you know, I saw a lot of things in social media where actual leaders in this country and province were kind of denying that systemic racism even existed. So, you know, the RCMP commissioner, for example, had to kind of be talked into it. So that, you know, that should be a non-starter. We should already be starting from that position. And then I think what we need to do is recognize that the healthcare system, and including the mental health and substance use healthcare system, still are very culturally unsafe places for our people to access services. And that is a big factor in people, you know, receiving the either programs, harm reduction programs, or treatment services that they need. So we really need to, you know, we work very hard on our partnerships with the province and regionally to try to address, you know, cultural safety and humility within the healthcare system and mental health care system to try to make things safer for our people to access services. And I think the other thing is to have, you know, meaningful relationships around the table. So not just be included now as a token, or that you have to have an Indigenous person sitting on your at whatever table it is that you're meeting at, but actually have meaningful relationship and include that input. So I think, you know, there is a lot of work to be done, and we will see what comes out of the inquiry. So I'm glad that that's underway, and I think it's going to really be a wake-up call for the province as to the extent that people are experiencing racism and discrimination in the healthcare system. That being said, it affords us an opportunity always to do better. And I think, you know, one of the biggest things that we've always, that I've noticed in my career as a psychiatrist before I came to British Columbia, I worked for over 20 years in a variety of settings, both rural, on reserve, and in urban settings, is, you know, people access includes people feeling comfortable to be able to seek those services. And then the other thing that happened, of course, in the pandemic is that many mental health services and addictions, substance use programs and services were reduced or switched to virtual formats. And that virtual format may be okay for people who may have already been connected to a service, but if you're kind of trying to access the service for your first time, that might be, again, a different kind of barrier to overcome. All of that being said, I'll end with saying, you know, that with crisis always comes opportunity, and here at FNHA we have developed 2 special services. One is the Virtual Doctor of the Day program, and our to be launched in a formal way this Monday, the Virtual Addiction Medicine and Psychiatry service. So we are actually leading the work in trying to improve access to mental health and substance use services for BC First Nations people across the province, wherever they may live. Thanks.
Thanks, Nell. I always appreciate how you're able to tackle really big questions and always come out of them with a very positive outlook. I'll turn it next back to you, Corey. What public investments does your research indicate would be most effective at preventing further mental health and substance use impacts across populations in BC?
Thanks so much for that question, and I agree. Yeah, it was beautiful to listen to what you had to say now. Thank you. As I mentioned, there is still so much more to share with everyone in terms of our findings, but clearly our data show that these are issues that require policy level solutions that need to be grounded in an equity lens. There's a need to use a mental health promotion lens when looking at mental health and substance use responses and solutions as a key component of a comprehensive mental health approach. So that mental health promotion approach signals that it is in addition to prevention and treatment, but also recognizes that we need to move beyond a strictly biomedical and or individual oriented model. And so this is a strengths-based orientation, and it focuses on protective factors while lessening risk factors. And it is used to support and create capacity for mental health at the individual, community, and population levels, and with a centering on issues of equity. And so the idea of this, by focusing on mental health promotion, then we're able to address the social determinants of health that underpin many mental health challenges. And these come from things like racism, colonialism, ableism, food insecurity, and financial instability, which can be exacerbated due to low wages or lost jobs or precarious work, pre-existing health conditions. And these are just to name a few that are currently being exacerbated and more acutely recognized during this pandemic. So I would say, our research supports the need for public investments such as universal basic income, food supports and accessibility, opportunities for social and emotional connection. And this goes back to and highlights the point Nell was making before as well. Trauma and violence informed mental health supports and resources, as well as care and support for families. So this would include things like a child tax benefit and supports related to childcare. But really overall, we need to ensure that everyone has their needs met in a safe environment in which they are able to thrive.
Thanks, Corey. I'm going to turn it back over to you, Julia. Knowing that community is the place where people have their needs met, And the pandemic has changed the provision of community-based services for people living with mental illness and substance use. How would you characterize that change, and how should this change influence future investments by the province?
Yeah, no, it's really wonderful to hear about some of the innovations that are coming forward. And I think, you know, I think Nell highlighted some of those that are happening through FNHA. And I think this has been a time of innovation actually for the mental health sector in general. At our branch here on the North Shore, not only were we able to expand our geographic reach into the Sunshine Coast, but as we started to move some of our programs virtual, we were able to connect with communities that hadn't been served previously. We had a lot of people who were housebound for one reason or another, whether it was like chronic pain or whatnot. So as long as they had access to Wi-Fi and access to devices and were connected to us, they were able to reach out, and we are able to serve people really across the globe, I think, to be honest. And I think that's true for a lot of people who were housebound, is that now they have access to so many more services than they ever had before because everyone's had to move online. So on the one hand, you know, we are connecting with a whole new group, new groups of people, you know, but I think we have to still acknowledge that, you know, whether we're delivering peer support or counseling, we're creating support groups or social groups or medical services or psychiatric support, you know, at the end of the day, there are a lot of people that aren't accessing those services. And, you know, I think that's where we're going to have to go over the next couple of years as we start to see this. We don't have an end in sight with the pandemic, so we're really going to have to start to tackle some of those inequities, which are, you know, access to reliable internet. I mean, I couldn't participate in this presentation if I didn't have access to a reliable internet source. So we're not hearing from people, you know, in remote areas as much. You know, if we don't have devices, if we don't have a safe space to access services, I mentioned that before, but that's been a big barrier for many people who have called us asking for counseling and have said, you know, yes, I absolutely need access to counseling, and I can't do this online. I can't do this at home. I don't have a safe space to have this conversation. Nobody in my family even knows that I struggle with a mental illness. So I think we really need to really think about this from an equity lens as well. I think some of the others, there's also just a level of comfort with technology, and whether, you know, technology is allowing us to really create those meaningful connections with one another. You know, there's nothing like being on a counseling session with someone and having your screen freeze up, and the kind of mistrust that's sort of created inadvertently just because the technology has a bit of a gap. So, you know, I think we can't take away from the fact that we still need to be thinking bigger picture and supporting some sort of innovative strategies around shared communal spaces where it is safe. And, you know, as much as my team has come to me and said, you know, we're doing everything virtually, we're still not meeting so many people's needs. And so I keep going back and saying, like, okay, well, we're going to have to start thinking about parks, and we're going to have to work with the city on permits and whatnot so that we can host support groups and, you know, outdoor spaces. So we are delivering counseling on, you know, in the community. We're going on walks with people. We're supporting families and individuals through peer support, sometimes, you know, in the community. And I think we're going to have to keep doing more of that. And the system's going to have to support us, and the different levels of government are going to have to start making some of those bigger spaces available to us so that we can help those communities as well.
Thanks, Julia. So I have one kind of last question for each of you that really looks at immediate next steps. Knowing that the province is going to invest $1.5 billion into stimulus recovery in the coming months, how can we make sure that mental wellness is meaningfully prioritized, and how can we strengthen our services? What are immediate next steps, immediate investments the province can make? Nell, I'm going to turn that question first to you.
Great, thank you, Amelia. Okay, so I'll just take a first start at it because that's what I'll do. So I think one of the first things is that, you know, providing, you know, trying to support and improve all of our mental health and well-being, and then for specific populations. You know, for at least as far as Indigenous First Nations people are concerned, you know, the solutions really are going to lie both within and beyond the health system. And by that, I mean, you know, we have to look at sort of what some of the root causes are for the mental health and emotional distress that people are describing, for example, during the pandemic. So all of these things existed before the pandemic, but I think there's a certain exacerbation that's happened with the pandemic. So things, you know, social determinants like poverty, education, lack of employment, and then improving self-determination, including things like having control over their lands and their territories. So as was mentioned, I think Emily mentioned it, you know, because of the inequities in some of these social determinants of health, that this has caused even greater disparities for people during the pandemic. And so it sounds like kind of a vague recommendation, but you know, honestly, I feel like it can't be stated enough, because we keep trying to address mental health issues kind of in isolation. And it's the same way that people talk about the opioid crisis. It's like, oh, we have to, you know, solve this substance use issue. But, you know, people use substances because they're emotionally distressed. No one chooses to become a problematic substance user at the beginning, right? They do it because they don't want to feel that way anymore. They want to alleviate their distress. They don't want to feel anything. They don't want to think about anything. So it's the same principle, that we can't just look at mental health in isolation and expect things to improve. So it has to be a whole of government approach and in an intersectoral way. I think the other thing that I mentioned earlier was just, you know, looking at funding culturally safe services, and that includes services that provide both Western medical and traditional, traditional ceremonies and cultural practices, whether that's together in a clinic such as the clinic here in downtown Vancouver and other places, or whether, you know, they're separate standalone. But one thing that is an outstanding issue is, you know, treating our traditional healers on par with Western trained practitioners. You know, currently they're not valued in the same way. Julia mentioned, you know, the sort of, you know, crisis lines and having access to things that are sort of at your fingertips. And she mentioned the connectivity issues, and that's very much an issue in our communities, as well as, you know, different apps that have been developed, such as the Lifeguard app, which is great if you have, you know, connection and data to be able to use that app. And so some of the immediate sort of interventions that have been put in place, you know, for example, there's a focus on cognitive behavioral therapy, but I think we would like to see trauma focused therapies being available, because that really is the underpinning of why people are struggling during this time. And the last thing I'll say, just as I end off, is, you know, we really need to have some investments into increasing our First Nations and Indigenous health human resources. And that includes training people in a variety of different ways, both as regulated health professionals like nurses and physicians, but also investing in upping the skills and the capacity of people who work in the communities, like the addictions workers or the mental health workers, to feel that they actually have the tools and the skills to be able to manage distress. So I think the last thing, because you say I always end on a positive note, you know, on the weekend, I'm president of the Indigenous Physicians Association, and we had a virtual graduation ceremony for all the Indigenous medical students who finished this year and didn't have a chance to experience the usual ceremonies. And there were a number of students on the Zoom graduation ceremony who expressed an interest in psychiatry, and I'm not suggesting that's the be all and end all, but it's just so nice to see that more people are becoming interested in careers in mental health, and ultimately I think that's going to make a difference moving forward as well. Thanks.
Yes, absolutely. I think it's incredible news that there are more Indigenous people taking on roles in the mental health sector. I think that is going to contribute to a lot of positive change. Corey, I'll turn the question over to you next. What have you identified as immediate next steps? How can the province invest right now for better mental health in this province?
Thanks so much. I think a lot of my ideas really echo and align with both Nell and Julia's points. And I was thinking, as Julia was talking too, about the connectivity and everything, and just even the fact that I can't get my webcam to work and the difference of how that may feel to participants. And it is such an important consideration to make in terms of how we are able to connect and have that social interaction. And so it's an interesting time period that we're experiencing and innovating in. Really to connect with what the other panelists have said, our priorities need to be focused on investments that attend to the social determinants of mental health and address the deep inequities across BC. I think one key opportunity is to prioritize, again, meaningful connection, and particularly for those who may be isolated. I think Julia and Nell both made or gave examples of what that may look like, and that can be due to mental health conditions, disability, or other reasons of someone needing to be homebound or to stay physically distanced from others. Another priority is to offer universal coverage for psychotherapy. But I would also say, in addition to this, I'd also like to really highlight the need to invest in priorities that focus on conditions that, that don't further perpetuate the need for populations and people who are already struggling and often feeling overwhelmed to take on further burdens for their own well-being. I think sometimes the rhetoric around this can be that we have to do our own self-care and we have to kind of, fix it all ourselves, versus going back to those key areas of social determinants of health. And so this goes back to what I was talking about before with needing a mental health promotion lens, and kind of moves us away from strictly focusing on what the individual can or should be doing, and instead refocuses the conversation on how to create environments and resources and contexts that support people to be well and to thrive. So I think it's a two-pronged space where these two things need to come together and support each other. So I'll leave it at that for now.
Thanks, Corey. I'll turn it over to you, Julia. Can you identify some immediate next steps or investments that would help your community on the North Shore achieve better mental health?
Yeah, I mean, I don't mean to sound like I'm echoing everyone else, but I mean, of course, like increasing access to psychotherapy is a huge need in our community. We did get some funding from the provincial government to enhance some of our services. That funding ends in October. Our wait list is huge. We have so many people calling us asking for that help and that support. So absolutely, psychotherapy is one of them. Housing is another. I think, I know we talk about housing all the time. It feels like the never-ending conversation, but yes, modular housing, but at the same time, you can't just build modular. You should be building housing at the same time that you're building modular housing. And we absolutely need that here on the North Shore. And we need to have some clarity around whose responsibility it is, because I tend to get a lot of pushback from different levels saying, it's this party and it's this party, and that's why it's not happening. And we're seeing the numbers go up. And so I would like to, see a more of a coordinated municipal / provincial / federal response to the need for housing. I can't help but we've been having some conversations with the RCMP. We've been talking about crisis response. We've been talking about the need to decolonize our work, to look at anti-racism. I can't help but think that one of the most immediate things we need to be doing as a community is having more webinars like these, where we really acknowledge that people are experiencing this pandemic differently, and that people come to this pandemic with different levels of access and different experiences and historical experiences. And I think the trauma lens is absolutely key. We need to be having more conversations that make us uncomfortable. And I know everyone's tired and it's difficult. It's difficult work, but I can't imagine that, like, in my perfect world, the legacy of this pandemic is that we really have those hard conversations and we acknowledge the pain that has been caused, and we take responsibility for doing things differently. So, I think one of the most immediate pieces around that, and as much as I want to have a preventative lens and work in mental health promotion, and CMHA has been so much work to kind of move us upwards in terms of that whole upstream approach, crisis response needs some immediate attention, whether that's in community. I've talked to Tsleil-Waututh Nation here, and I know they're looking at a crisis response, but for the RCMP and the smaller police forces across the community, we need to invest in a different crisis response for mental health and substance use. What we're doing isn't working, it's causing harm often, and we need to, yeah, we need to invest in some new models. So that's what I'll say on that front.
Thanks, Julia. We'll now open up the webinar to audience questions. Please feel free to write your question into the question field, and if there's a specific panelist you'd like to address it to, just mention it and I'll make sure that it's asked to them specifically. To get us started, I'm just going to turn it over to Johnny Morris, our CEO, to ask a question of the panelists. Johnny, over to you. Oh, we can't hear you at the moment.
There we go. I'm so used to Zoom, so I'm now just recalibrated. Hopefully you can hear me now, Amelia. Thank you so much. Well, what a rich discussion, and with great questions, Amelia, and deep and rich responses, both, I think, reflective and calling upon action. I just want to linger on this theme that Julia, you were running with your last response, and I'd agree with you. I think trying to find a way to build momentum, consensus, and that path forward with regard to crisis response in this province is critical. One that, to Nell's commentary, speaks to the intersectoral realities that we live within. I'm wondering, you know, in that vein, you know, what would you say would be kind of the immediate next step, or the immediate next two steps that could start to advance a conversation that often, I think, for many feels far too complex to take on? What would your advice be there, Julia, on that crisis response improvement?
Oh yes, well, there are models that are working in other jurisdictions and other communities, and maybe they involve less of men, you know, no, mostly men, and arriving in uniform to situations where, you know, there's a lot of vulnerability, and there's a lot of fear, and there's a lot of trauma. And how do we start to look at who else can be on the front lines of that? We had a presentation with the RCMP, who have been very gracious about connecting with our agency and having this conversation. But I don't think they get a lot of training about how to respond to some of these situations. And very often, you know, the paramedics are saying, oh, we don't feel safe going into those environments, so the police come first. You know, the reality is that people with mental illness are not dangerous. You know, in almost every situation, they're not dangerous. And even the police will admit that. So if they're not dangerous, we need to have a different response. And maybe that starts with looking at, you know, some of the models. I know, Johnny, in one of the media releases you sent out, there were some models from Eugene, Oregon, and elsewhere. I think even in Halifax, there's some integrated units where there are social workers or psychiatric nurses or peers that are trained to do de-escalation. And I think once you have someone who shows up at your door when you're in a very difficult situation, who can say, you're not alone, I've been there, I've been through something similar, you know, I'm not here to arrest you or take you anywhere you don't want to go. Let's figure this out together. It's a different experience than being faced with a consequence right off the bat.
Well, thank you, Julian. I'm not sure, Amelia, if there's time for Nell or Corey to respond to that same question, but I appreciate your response there, Julia, very much. Thank you.
Now I'll actually turn that question over to you, and then I have one audience question for Corey that we'll end the webinar on. So first, Nell, go ahead.
The only thing I would add to what Julia said is, you know, if we're going to develop different and more accessible and safer crisis response services, because I think that's the issue that we're facing. I just heard a story from a friend living in Ontario last night that her brother is in difficulty on the East Coast, and they were going to wait all night until regular business hours this morning to have a mental health worker check up on her relative, because they didn't want the police going to the person's house to do a wellness check, because as we've seen quite recently, First Nations individuals, 2 of them have been killed in those situations. So I think that's one, safer. And the other one is just, you know, if we're going to talk about crisis response in this case, then it needs to take place across the province, not just in urban centers, not this urbanized view of things, urban centric, but in rural and remote places as well. And it's going to take some pretty innovative and creative thinking about how that can, you know, what that will look like.
Thanks,
Thank
Mel.
you, Nell.
I'm just going to turn the last audience question over to Corey. They were very interested in the presentation you gave at the beginning on mental health impacts. They ask, is there going to be more analysis into the mental health impacts specifically for vulnerable populations? When is this expected? And is the data published in a report that they can download?
Oh, I appreciate that. There has been a released, like a public viewing of some of the overall data that I shared today, and I can try to, I'm not sure how to best to find the link for that and be able to share it, but maybe I can send it to you, Amelia, if there's a way to get it to people who are interested. We are in the process of also publishing some peer-reviewed literature on it. So we've got 2 papers that are in review right now, one that focuses on the overall impacts, one that's focused on the impacts for families and children. We're currently writing up papers on the areas of food security, as well as the emotional impacts. And then the data actually was originally aligned with some survey data that was happening across the UK with the Mental Health Foundation over there. And so we have been connecting with and partnering with them, and we'll actually be able to be doing some cross-country kind of looks at what's looking similar or what are some of the differences. And we're actually just preparing now for our second wave of collecting data, which should hopefully happen mid-September. And then we have a plan for a third wave as well, maybe more towards the end of the year, beginning of next year. So yeah, there'll be, I know some pieces have come out in some of the newspapers as well that kind of focus again on the overview, but there'll be more some specifics that highlight different vulnerabilities in different populations. So
thanks, Corey. And if you share that link with me, I can put it in the follow-up email to attendees so they're able to access it after the webinar. And I'll also point out too that there is a handout that you can download that's an infographic and shares some of the high-level impacts that Corey spoke about in her initial presentation. So that is everything from us today. Thank you again to our panelists and everyone who joined the webinar. Before we sign off and resume our days, I want to acknowledge again that this is a difficult time. If you or someone you know is struggling with their mental health, please do reach out to us. As an organization, CMHA is dedicated to supporting British Columbians to achieve their best possible mental health. We recognize the immense challenges people are facing because of the pandemic and have scaled up our services to help. Most notably, we created an easy to navigate website with links to a range of resources from cognitive behavioral therapy to community counseling to assessment tools. If you are able to, please visit cmha.bc.ca/COVID-19 or email us at help@cmha.bc.ca if and whenever you need. Thanks again for taking part in today's discussion. Please take care of yourselves and stay safe.